And welcome back. Welcome back to Open Your Eyes. And we're moving now into our first segment for the morning.
Yes.
Now, this one is all about the HPV testing. It's about testing. And a lot of people might not know what HPV is. We'll be talking about that, dive into it a little. But we've got the professionals in to talk to us about that. Dr. Natalia Beer, Technical Advisor, Maternal and Child Health. And also Dr. Marcelo Coyi in with us, a gynecologist from the Belize Medical Associates. Good morning and welcome to both of you.
Good morning.
Thank you. Thank you
for
very
the
much.
invitation.
It's a great day to be great, especially having great people like you
Oh,
in
boy.
front of us. Yeah, right? HPV. We want to know what that is acronym for something, and then we dive into what it really is. Anybody, just pick it up. HPV, what is that? Go.
Well, it's as I said, the acronym for human papilloma virus. It's a virus that is very common. You know, they can cause warts in your skin depending on the type. But there are certain types that are more involved with the urogenital system. And so when this virus gets in contact with what we are talking about today in the cervix or the mouth of the womb, there are certain types that are called oncogenic viruses. So onco is cancer and genesis is the beginning. So these viruses can begin a process in the mouth of the womb, particularly type 16 or subtype 16 and 18 of HPV, that left over a period of time, they cause changes in the cells of the mouth of the womb. And if left of changes, they go through abnormalities that are mild abnormalities, then they become moderate abnormalities, then they become severe abnormalities, then they become, we call it carcinoma in situ, that means it's there but not spread, and then invasive cancer. So we know that it's the etiology of cancer of the cervix. So here is a test where we can pick that virus from the very beginning of that process. We don't wait till later and then.
So HPV seems to be something that persons can easily contract. And how do we become aware of that?
That's the problem, is that it's an asymptomatic infection, not like a bacteria will give a discharge, or it give you a odor, or it give you bleeding or something there, do nothing. And we calculate that cumulatively, the risk of you getting it is about 80%.
Wow.
So it's quite common, quite common in the.
So what would be like a ratio of how many persons would have HPV?
That's why about at the end of your lifespan, there's an 80%. So out of 4 we are at the end of our life, 3 we have HPV.
More than likely would have it. Who are carriers of HPV?
That's the problem, is that because you have no symptoms until you reach the end stage of cancer, then we are carriers and we don't know.
Does it work like the herpes virus, where some persons have it? It's a genetic virus, and it is subtle in others and then not so subtle in some.
Well, it's not genetic. It's actually a sexually transmitted disease that over a period of time can lead to cancer of the cervix. What was the other concern?
No, I was wondering if it works in a way where, because John was asking how some can be carriers, and I was just wondering if it is subdued in some, whereas others it would.
Well, there are certain people, that have increased probability that it will progress. People, for example, with HIV that are positive, because their immune system is depressed. Then these viruses go quicker.
How come, Dr. Beer, how come as young girls or as young adults, we don't really learn about HPV? And this particularly seems to be a conversation you would have when we're talking about STDs, when we're talking about puberty and so forth. Why is it that we're not having these conversations? Why are people not getting tested for this?
Well, the HPV vaccination program allows that opportunity to share with the parents the link between HPV and cervical cancer. So our HPV vaccination program which is a school-based vaccination program. The objective is to prevent cervical cancer. So we have that opportunity. And it's not something that, because we don't have signs and symptoms in the early infection, then as Dr. Coyi was mentioning, 80% of the population will be affected throughout their lifetime, but we don't have any signs and symptoms, so it's not a topic that people would discuss.
Does it affect men?
Yes.
Yeah.
How? Because we're talking here
Carriers,
cervical
well, in
and
men, actually, it's a good question because in where I studied in Jamaica, there was a high incidence of penile cancer, cancer of the penis. And when you look it up, HPV is responsible. The same oncogenic viruses that can cause cervix in the men, it can affect them too. But as you say, the majority of them are asymptomatic, they don't cause nothing. It all depends on the type of the virus, 16 and 18 were HPV, and it all depends on the immune system of the individual.
Yeah. Now, the reason for these questions is for people to understand the importance of going out to test, because we're getting to the testing.
Yeah.
You did say, Doc, that there are two types of it. Talk to us about those two types.
Yeah, the subtypes are the 16 and 18, that when studies are done to link the cancer of the cervix, these are the two that are responsible for the 90% of the cancers of the cervix. And so
16 and 18, yeah.
yes, and so the new technology that is being brought into Belize by the Ministry of Health is to detect these viruses.
Yeah.
So now we've got it in terms of to detect it, the testing part of it. Why is it? Well, we know how dangerous it is. We've been talking about that. Let's talk about the testing part of it. When we talk about the testing, what does it entail? Is it we get injected? What happens here?
It's the HPV test is a swab that is done in the vagina. So we call it a dry swab because we give you a tube and a brush, cyto brush we call it, where you collect the sample, and then you just break the brush in the tube, and you close it. So it's an easy test. It can be done at home, but we are not doing it at home as yet.
Okay.
We're only doing it at health facilities. And the woman can do it herself at the health facility, hand over the sample to the nurse or the doctor, or if she doesn't feel comfortable to do it herself, then the nurse or the doctor does it for her.
Okay.
And there is no use of speculum. Women don't like the speculum much.
How are we
So
being
that is not
tested
needed. So it's just to
before?
take the sample from the vagina.
How are we being tested prior to this, or is this the first time this
Yes,
technology is being
thanks for asking that question, because before we used to screen for pap smears. We have a lot of difficulties with the turnaround for pap smears, especially in the public sector. And then we introduced the visual inspection of the cervix with acetic acid and VIA. But these two tests, what they are looking for is for, as Dr. Coyi mentioned, changes in the cells. So we detect precancerous cells or changes with both tests. But with the HPV test, you may not have no cervical changes as yet, but you have the virus that may lead or will lead to cervical cancer. And then the next step is every woman that have a positive HPV test, then she's re-screened again with VIA. So if we detect any changes there, you can be treated immediately. Or the pap smear, if she doesn't meet the criteria for the VIA.
Can HPV be cured? Is there a cure?
No, once it's into your system, it's there, no? It's lifelong. That's why we could pick it up in 80% of the people. But I think what I would like to add to that is that the pap smear or colposcopy, or what we normally would do, is one, it has a, what do you call it, a high false negative rate. So you take it, it's nothing wrong with you, but there's a 10 to 15% chance that something is wrong with you and it doesn't pick it up. In addition, as Dr. said, the turnaround time to get a result in the public system. The PCR is a DNA technology. You know the PCR test that we did with the COVID.
Yeah.
That we said that test not good but we like the PCR because it's about 99% sensitive, so you can pick it up. And so it's a more accurate test than the pap smears in detecting the beginning of a possibility of cancer of the cervix.
Yeah.
Not only is it, I say, more accurate, it's also less invasive. In that, Dr. mentioned, you don't need to use a speculum. You can self-administer it. Two is that with the protocol that Dr. has put in, that the turnaround time for that test, since it's a machine going to read it, it should be less than 7 days, Dr.
Yeah. 1 week.
Okay.
1 week, yeah, same thing. As opposed to the pap smear that goes to a central place that 1 or 2 persons in the country read it in the public system. So the turnaround time is months
Little lengthy.
sometimes,
Yes,
right?
yes.
And so you lose that effectiveness in a way. So these are more accurate, it's less invasive, and you will get your results sooner.
Knowing your status on HPV
Yes.
is very vital. It's a very important thing to note.
Yes.
Testing is done only in women, knowing that men do carry the virus.
It can be done on both, but the present program is trying to decrease the incidence of cancer of the cervix.
Cervical
So it's
cancer.
being limited to women who are the
Yeah.
ones who get cancer of the cervix, where we pick up those bad ones, the oncogenic ones, 16 and 18. And so if a person is swabbed or she swabbed herself, and you don't have none of them, the 16 and 18, you could say, all right, come back in 3 years' time. That's the
Yeah.
protocol. No, you have to worry for 3 years then. As opposed to if, in fact, it's picked up to 16 and 18, then we grab you and say you need to now need more careful attention.
Yeah.
We need to do the pap smear to see if you have changes, the VIA, the visual inspection
Yeah.
with acetic acid, or another test with a microscope that we call colposcopy. So you kind of like select out of 100, maybe one have it, so that you put your resources in that one person.
Yeah.
The rest, you could wait.
You can wait 3 years.
And one of the, in this new testing program, Doctora is introducing people, it's for people who have never been screened.
Yeah.
So if you had a pap smear last year and you get your result, nobody come.
Yeah.
You know, it's for people who have
Never been.
haven't done it for more than 3 years.
Okay.
So if your last pap smear was 4 years ago,
Then
you're a
come.
candidate.
Okay.
You also have between an age group of 25 to
To
65. And there's a reason for that, because cancer of the cervix in the young is rare, and also it's almost non-existent at age 65. So it's in that group where that is at risk. This test is in the protocol is saying if it's between this age and 45 or 65, you have never been screened for the last 3 years, having a pap smear and not getting no result, that like
That I can
Like,
do.
do it,
never
like,
get
you know, do
done.
it.
Yeah.
So it has to be verified that you did it and you get a result.
So
And it's-
once you are tested and your results are positive, what does the treatment look like?
Well, as I said, there is no treatment. It
There
just
is
puts
no-
you at risk of cancer. Now, take you now.
So there's no medicine.
But we'll take you now and we're going to look at your cervix. Remember, the genesis of it is the
Right.
virus. So we're going to look at the cervix to see if that has caused any changes in your
Yeah.
cervix.
Yeah.
And if you look and say there is no changes, then it's there. You're at higher risk if you have 16 and 18, but it's fine. No worry. So we'll do you in a year's time again.
Yeah,
Okay.
yeah.
And
Just
we'll
to
check
check.
you more regularly than the one we're negative with
Yeah.
in 3 years.
And the reason for all of this is to detect at early, and so you can be treated early.
Yes.
Yes.
All right, so there we
Yeah.
go.
One of the fundamental vaccines that at a particular age, I think once you hit 18 or so, along with your tetanus shot, is your HPV vaccine.
Vaccine.
Right.
Right.
Yeah.
So and that is to prevent.
Prevent it.
Cervical
Right.
cancer. And the prevention is 100%.
Oh, wow.
Wow.
If you get the vaccine at a recommended age, 9 to 14, the prevention is 100%. Australia started their vaccination campaign just right after the vaccine was introduced worldwide. And they are about to eliminate cervical cancer.
Wow.
Are we
Their
seeing
coverage is super high. Our coverage is still a bit low, around 50%. We need to increase it. And we have been vaccinating boys also.
well, I know about these vaccines because there used to be the coming to school campaign
Yeah.
where you do your measles, mumps, rubella,
That's
you
at the
do
entry,
your
I think.
HPV, you do your tetanus, all of these.
I think
different
this one, the
vaccines.
HPV vaccine has that standard 4.
Standard 4.
Standard 4
Yeah.
is the
Yeah.
at which.
Are we still doing these
Yes.
kinds of, okay.
Yes, we still have the school health program running.
Okay.
And there are different vaccines also, you know. They begin with the bivalent, which is against the 16 and 18,
Yeah.
the quadrivalent, and there are some even more advanced
Monovalent,
ones
9.
that they protect you against 9 of the HPV viruses.
Wow.
We are
Because
doing
remember,
the 4.
some viruses also cause warts
Yes.
Yeah.
of that area.
Yes.
Right.
So it
So-
prevents those ones.
So I know that this is particularly for screening for cervical cancer, and so you want to assist more for the women to come and
That is
get
correct.
tested. But is there any possibility that the ratio of HPV would show up more for men than they would for women?
Well, it's not being done in men at the moment. This program is particularly for.
Starting off with the
women.
priority group, which is women who
Yeah.
suffer cervical
Yeah.
cancer. Yeah.
And this is primarily to try to eradicate cervical cancer.
Yeah.
Now,
Precisely.
you did mention, about young girls, 9 to 14, who are able to go to get their vaccine. Now, it was a school rolled out situation, vaccine program. If my daughter turned 9 years old, am I able to go to a clinic and get the vaccine?
Well, if she's in school, it's best if she get it in school.
Okay.
Because we have 2 visits, we do May and November.
Okay.
Yeah.
But it's limited to do the vaccine before they begin sexual activity.
Okay.
Remember, vaccine is to prevent.
Yes.
So if you
Yeah.
don't have 16 and 18, the vaccine
It
not
doesn't do
work.
anything
Exactly.
for you.
So that's
Yeah.
why that's the reason for that age group,
Ah.
standard 4, standard 6.
Yeah.
And then, so because there's a limited amount, we say we want this age group. So give it age 5, right?
Yeah, yeah, yeah.
We'll give it to
Right.
that age group. And
Do
the,
they,
the reception has been quite good, from
Yeah,
what Dr. Ray
yes.
is telling me in the schools, no?
yeah, and that's why
But
I
of
asked
course,
about
that's not help we till the next 10 years.
Yeah,
Right,
yeah.
right.
Next generation
Yeah.
up. They're
The
coming
next
up. Yes.
generation,
Yes,
right?
yes, yes.
So that's why it's a two-prong approach. The vaccine for the future and the HPV for,
To
for, the,
detect
for
the
now,
risk today,
for the
yeah.
people who are...
So even if, let's just say the slightest chance that somebody gets the vaccine and then they still wind up for some weird reason with HPV, what happens then?
And the same process followed.
process.
Yeah. If it's positive, then you do the VIA preferably, or the pap smear.
Okay.
Yeah.
So going out for the testing now, because this is the most important part, the testing so that it can be detected. And this
Yep.
is being rolled out at every clinic across the country?
Yeah. Every health facility.
All right. So it's
And,
totally accessible.
Yes. Right
And
now
it's
we
at
are.
no cost to the person in the public system.
So free.
Yeah.
You're not free, you're not free, you're not free. It's free
Somebody
at
have
the
to pay.
point.
I get
I
you,
wish-
Doc, I get you.
Somebody have to pay for
Somebody
the
have
test.
to pay.
Yeah.
Somebody have to pay. Taxpayers, we have to pay.
That you and me, right?
Yes,
We'll
of
pay,
course.
we'll pay
Yeah.
so that no one gets cervical cancer.
Yes.
We
But
must
Dr.
big up the government, they procure the machine for us and the first batch of tests. And also PAHON UNFPA will help us, providing with test kits for gene expert. Now, right now, all samples have to come to Belize, but in January, the samples will be tested at the regions because we have gene experts deployed in the country. So that's a plus for them. No?
So the testing, you've already begun.
Yes.
Okay.
Yeah, we already began.
All right.
Well, this has been available in the private system before.
Yeah.
For a while.
Okay.
Okay.
Yeah.
But this is not for the
This
public.
is for the public.
Yeah.
But it's actually, I must tell you, it's quite an expensive test. In the private system, it's about $300
Wow.
it costs,
Yeah.
Wow.
So it's a good thing that it's being rolled
rolled
out,
out in
Yeah.
public health
in the
facilities.
public health
Yeah.
facilities.
All right. Is there anything else you guys would like to share with us with respect to this particular testing or conversation?
I just recognize the role that the National Cervical Cancer Committee has played in introducing the HPV test. And we have a team of health professionals and others, like the special envoy, Dr. Coyi is part of that committee.
That's where I fit in.
Yeah, one of his many hats. And they're supporting this initiative. And for women, you know, get tested is,
Yeah.
and if you have a young girl at home, get her to get the HPV vaccine. It is recommended up to year 26,
Okay.
up to 26 years, but we don't have that amount.
Okay.
We buy for standard 4. So if you have a child in standard 4, make sure that you support them so that they can prevent cervical cancer.
Excellent.
And for our kids, you know, that did not get it in, let's say, in the last 5 years, they can go to the health facility and get it also.
Okay.
Or at the school when the team is there, if they are in standard 6 or in high school, then they can access the vaccine.
I asked about the education program for it because the severity of this particular virus, I don't think that we discuss it enough. We talk about
Yeah.
HIV, we talk about all of these other cancers, but we don't really talk about HPV. And so I do recall, you know, when we were in primary school, the program came, we take a vaccine and so forth, but the information doesn't stay.
Yeah.
So
you're right.
in terms of continuing the education program, perhaps in high school and college, is there any conversations along those lines?
Definitely we need to include it since we have now vaccine and testing. I think we should do more education. You're right on that.
Yeah.
Yeah.
So there are 200 plus types. Out of those, 15 are related to cervical cancer.
Wow.
For people to know, you know, that the prevalence is 80%, so it's high.
It's high. That's very high.
Yeah.
Very high.
And if you could prevent any kind of cancer, I think that
Yes.
why not?
We
Exactly.
should, because it's so, I find as a provider, no, it's so emotional, you know, when I see patients with cancer of the cervix. It's
Because
a
you know it
totally
could be
preventable
prevented.
disease, and
Yeah.
and once you get cancer of the cervix, there is a mortality to it, depending on how much it's spread, no? And obviously, if you're at stage
aggressive
4,
it is, yeah.
you know, 90% of the time you're dead.
You're gonna
It's as
pass.
simple
Yeah.
as that, and it's
Yeah.
something that in the past we would say do your screening with pap smears or VIA. Now we're saying even earlier than that.
Even
Yeah.
earlier. And
Yeah.
it's a simple swab, and you can do it yourself.
That's correct.
Yeah, we usually go to the doctor to seek care when we have symptoms.
Yeah.
So for women, please don't wait on symptoms to get screened or treated,
Yeah.
because that is too late.
Yeah.
So just, you know, 25 years, start your HPV test, and then we follow there.
And so you just
Every
go to
3
your health
years.
facility and you ask for a test.
Yes.
You'll
HPV
your
test.
HPV
HPV
test.
test.
You'll get that test. You do your swab. You submit that in, and after about 7 days, you
Yeah.
go back and you get your
The
results.
following week, you would get
You
your
get your
results.
results.
Yeah.
And it's such easier now that in the public health system, because the lab has a computer system
Yeah.
called BHIS,
Okay.
where the lab technician puts the result there, and the healthcare provider in Toledo just look it up and see your results.
it.
So you don't have to like
So everything
wait
is
for the
electronic.
Wait to
results.
make them
Yeah.
call you
Until they
or
send it to you
send
up
it
to
to
your
you.
GP.
to
Never
GP.
reach them.
yes, so I totally understand. Yes,
Yeah,
Dr.
and if persons think that, oh, we may not have 16 and 18 in Belize, we do have. We had a survey that was done in 2007, and we had positive for 16 and 18. Actually, that was the highest frequency that detected.
Wow.
The first 100 tests that we've done with HPV, we had 24 that were positive. But for 16 and 18, it was only 11%.
Okay.
But 24, I mean, one out of us
What are we?
have high risk HPV,
Wow.
that level. So we
Yeah.
really need to get tested.
Go get tested.
Yeah.
people. Go get tested. It is ruled out in the public health facilities now. Anywhere in this country, you can get
You are
tested
able to.
now.
25 to
25
65,
to
and
65.
within those, if you have never been tested, you're number one for us.
Yes.
And if you have a test that was done 3 years or more,
More?
that's
Come
the
on
second
in, get
candidate.
tested again.
Yes.
All right. Well, Dr. Natalia Beer and Dr. Marcelo Coyi, we want to thank you guys so very much for coming in this morning.
Very important.
Thanks
Very
also
important
for
conversation.
the opportunity to be able
Excellent.
to communicate
Excellent.
Yes.
Because,
information.
because the conversation, in order for anything to work, everybody needs to buy in and everybody needs to know the information.
Yeah.
Now we know that in Belize, we can test for HPV. Go on out and
Preventing
do that.
cervical cancer.
Excellent. Thank you guys once again.
Thank you.
Well, April, we're going to take a break. And when we come back, it's all about the IOM. It's actually the amnesty extension because they extended it, which is a good thing. We'll have that conversation when we come back. Stay with us.